Stung by a hornet, a comprehensive guide to immediate action and recovery. The sudden, sharp pierce of a hornet sting is an experience few forget. Unlike honeybees, which leave their stinger behind and perish, hornets are equipped with smooth stingers that allow them to strike multiple times. Because hornets are larger than most social wasps, they carry a more significant volume of venom, making their stings particularly painful and, in some cases, life-threatening. Knowing exactly what to do in the moments following a sting can mean the difference between a few days of itchy annoyance and a medical emergency. Here is a detailed breakdown of the reasons behind the pain and the essential primary care solutions. Phase 1, Immediate Safety and Removal. The first 60 seconds after a sting are the most critical. Your body is reacting to a complex cocktail of toxins, and your environment may still be hostile. 1. Leave the area. Hornets are social insects. When a hornet stings, it releases alarm pheromones that signal to the rest of the colony that there is a threat. If you stay near the nest, you risk a swarm attack. Action: move calmly but quickly to an indoor location or a vehicle. Do not flail your arms, as sudden movements can further provoke the insects. 2. Inspect the wound. While hornets rarely leave a stinger behind, it is possible for a stinger to break off or for a stray bee to be the culprit. Action: if a stinger is present, scrape it away using a flat object like a credit card or a fingernail. Never use tweezers to pull a stinger out. Squeezing the venom sac can inject more toxins into your bloodstream. Phase 2, Understanding the symptoms. To treat the sting effectively, you must identify the severity of the reaction. Most people experience a local reaction, but some may suffer a systemic reaction. Phase 3, Primary Care and Home Solutions. If you are not showing signs of an allergic reaction, the goal is to neutralize the venom's effects and manage the inflammation. 1. Cleanse the wound. Hornet stings create a puncture wound that can easily become infected, especially since hornets often scavenge for food in unsanitary places. Solution: wash the area thoroughly with mild soap and cool water. This removes any lingering venom on the skin and reduces the bacterial load. 2. Control the swelling, cryotherapy. The venom causes blood vessels to dilate, leading to localized edema, swelling. Solution: apply a cold compress or an ice pack wrapped in a cloth to the site for 15 to 20 minutes every hour. The cold constricts the vessels and numbs the nerve endings, providing immediate pain relief. 3. Neutralizing the chemistry. Hornet venom is protein-based and slightly alkaline. While the vinegar versus baking soda debate is common, the most effective primary care involves addressing the histamines your body produces in response. Pharmacological solution: take an over-the-counter antihistamine, like diphenhydramine or loratadine, to reduce itching and swelling. Topical solution: apply hydrocortisone cream or calamine lotion to the site to soothe the skin. For intense pain, an NSAID like ibuprofen can help reduce the internal inflammation. Phase 4, Why does it hurt so much? The science. Understanding the why helps in staying calm during the treatment process. Hornet venom contains acetylcholine, a neurotransmitter that stimulates pain receptors more intensely than other insect venoms. Mestoperin, a toxin that breaks down tissue and releases histamine from your own mast cells. Phospholipase A2, an enzyme that destroys cell membranes, causing the characteristic redness and burning sensation. Because the venom is designed to cause maximum discomfort to vertebrates, the pain may persist for several hours, and the itching may last for several days. Phase 5, monitoring for secondary complications. First aid doesn't end once the ice pack is put away. You must monitor the site for the next 24 to 72 hours. Identifying infection. If the redness begins to spread after the second day, or if you see red streaks radiating from the wound, the site may be infected, cellulitis. Signs: pus, increased warmth at the site, or a fever. Solution: consult a doctor for a course of antibiotics. Preventing the itch-scratch cycle. The most common complication from a hornet sting is a secondary skin infection caused by scratching. Advice: keep your fingernails short and avoid touching the wound. If the itching is unbearable, a thick paste of baking soda and water can provide a cooling crust that protects the skin while it heals. Summary of first aid steps. Safety first. Move away from the nesting site immediately. Clean. Wash with soap and water to prevent infection. Cool, use ice to reduce swelling and numb the pain. Medicate, use antihistamines for itching and ibuprofen for pain. Elevate, if the sting is on a limb, keep it raised to reduce fluid buildup. Watch. Monitor for signs of anaphylaxis, hives, wheezing, fainting. Pro tip: if you have been stung more than 10 times simultaneously, seek medical evaluation even if you aren't allergic. The sheer volume of venom can put a significant strain on the kidneys. Getting stung by a hornet is a literal shock to the system, but with prompt cleaning, cooling, and medication, most people recover fully within a week. Stay calm, act quickly, and always keep an eye on your breathing. Your body's safety is the priority.